Hello everyone, welcome to sqadia.com, and now we will talk about amenorrhea in our last section of our lecture topic, disorders of menstrual bleeding. So when we will talk about amenorrhea, we will discuss about two main types of amenorrhea, which is primary amenorrhea and secondary amenorrhea. And besides this, we will also talk about what's the physiological amenorrhea and what amenorrhea is. Okay, amenorrhea is the absence of menstrual cycle or absence of menstruation. When menstruation is absent for 3 consecutive months, this is labeled as amenorrhea. So no menstrual cycle for 3 months, then the patient is amenorrhic. When there is amenorrhea, it can lead to infertility because for fertility and for conception, regular menstrual cycle is important, and ovulation on 14th day of the cycle. In case of 20-day cycle, 28-day cycle is important. And when no regular menstrual cycle, no ovulation, then infertility is the problem. Then also patient comes with osteoporosis. This is very common when the females reach menopause and when they are amenorrhic or when no regular menstrual cycles occur. These are the changes that occur in the bones because of the lack of estrogen hormone with the age. So osteoporosis is common after menopause, in which the bones, if you see the difference here, this is the bone. This is the osteoporotic bone here. You see it's very porous and you can see big gaps. The density of the bone is lost here. So these bones, osteoporotic bones, they break very easily. And if you can see here, just little, when the person hit somewhere or they fall, even with the little injury, the bones break very easily and they become very brittle. So this is due to deficiency of the hormone estrogen that occurs with the amenorrhea. Physiological amenorrhea is amenorrhea which is normal, that occurs normally in life, and 3 conditions leads to physiological amenorrhea: pregnancy, lactation, and menopause. During pregnancy, there is no menstruation for 9 months. So that's the physiological amenorrhea. If the mother is breastfeeding the baby, that leads to also physiological amenorrhea. So this gives the protection against conception. So as long as the mother is breastfeeding the baby, they cannot conceive. So they don't need any type of contraception until they are breastfeeding. Then the third type of physiological amenorrhea is due to menopause. Menopause is the age when the regular menstrual cycle stops. That's age 50 and above. So primary amenorrhea is when there is failure to start menstrual cycle after onset of puberty. So with puberty, secondary sex characteristics starts to develop, and with puberty, one other thing that starts is the regular menstrual cycle. That's because between the age of 11 to 13 years. And if no menstruation starts by the age of 15, then it needs to be tested. Usually there are problems like developmental disorders that can lead to primary amenorrhea. One common developmental disorder is imperforate hymen. If you see in this diagram, this is the picture of imperforate hymen. There is no opening in the hymen. So during the development of the baby, the perforation in the hymen doesn't takes place, so this leads to imperforate hymen. So by the time when the menstruation start, or when the girl reaches the age of menarche, blood start accumulating behind the hymen in the vagina. That causes bulging of the hymen. So when they complain of dysmenorrhea or pain in the lower abdomen, and when checked by the gynecologist, they can see that there is imperforate hymen, and the hymen is not open. So the opening in the hymen can resolve this issue, and normal menstrual cycle begins. So imperforate hymen. Then the other developmental condition is there is blockage or narrowing of the cervix. When this condition is there, usually it is treated by opening the cervix or by dilating the cervix by the dilator. Third developmental condition that can lead to primary amenorrhea is missing uterus or vagina. When no uterus is present or no vagina, usually the menstruation doesn't occur. Turner syndrome. Here, Turner syndrome is a chromosomal disorder which is in which there are 45 X chromosomes. So this miss one X chromosome, and patients who have this Turner syndrome, they complain in them the menstruation never starts, and they have infertility and amenorrhea and lack of breast development and all those issues. This can be treated only with the hormonal therapy, but usually it's hard to treat infertility in these patients even with the hormone therapy. Next is the secondary amenorrhea. Secondary amenorrhea is due to some causes. Regular menstrual cycles started at the age, normal age, but after there is 1, 2, 3 cycles, it stops suddenly, or maybe they stop at later age in the later life. And the causes of secondary amenorrhea, mainly they are due to contraceptive problems. If somebody is on contraception, especially Depo-Provera, here you can see Depo-Provera, medroxyprogesterone. This Depo gives contraception for 5 months or 6 months in a row, but it usually causes amenorrhea, or the regular cycle stops after getting Depo injection. So it can be due to Depo, it can be due to hypothyroidism, because low level of thyroid also causes amenorrhea and irregular menstrual cycles. Hard to conceive in patients with hypothyroidism. But once thyroxine is started, it's easy to conceive, and the problem is usually resolved. Tumors of pituitary gland also cause secondary amenorrhea due to lack of production of the hormone LH and FSH, which leads to the production of estrogen and progesterone by the ovaries. Then low estrogen levels also leads to amenorrhea because of lack of ovulation. Then polycystic ovarian syndrome. This PCOS, it stands for polycystic ovarian syndrome. It's a disorder in which ovaries develop multiple fluid-filled sacs or cysts, and they are not producing normal hormones. and no ovulation is occurring in the ovaries, so no conception. Usually patients with polycystic ovarian syndrome have high levels of male hormone androgen, so they present with features of hair growths like male, and they have facial hairs, they have weight gain and muscles like male. So all these features due to high androgen level. So in this case, polycystic ovarian syndrome also leads to infertility and amenorrhea. So all these are very common causes of secondary amenorrhea and need to be investigated and treated really good to avoid any further complications. So this concludes our lecture topic, disorder of menstrual bleeding, in which we talked about heavy menstrual bleeding, we talked about dysmenorrhea, intermittent menstrual bleeding, amenorrhea, and Wurzbaum-Cohen system of classification. Thank you for watching sqadia.com.